commenter is asking how we help our dogs deal with the issue of over-arousal, particularly as it pertains to intra-household aggression. This is definitely one of those questions that there's no short answer to. Every case is going to be a bit individual because there are a lot of different variables involved, and different amalgamations of those variables are going to lead to different behavior therapy plans. I specialize in nervous system dysregulation, and so for my client population, we're seeing hyper or hypoarousal, we're seeing anxiety disorders, trauma, or chronic stress. And then within that, I specialize in intra-household aggression. So a lot of times I have one or more pets in the home who struggle with chronic nervous system dysregulation, who are then aggressing against another pet in the home. Or another pet in the home is aggressing against them because of behavior often related to that dysregulation. So the first step is always management. We always want to put management around this behavior, and that's true whether we're talking about intra-household aggression specifically, or we're talking about these states of getting into high levels of arousal that the dog struggles to come back down from, struggles to regulate through, or that are linked to negative emotions or some combination of those factors. So if I have a dog who is experiencing high levels of stress due to anxiety, I'm putting management around those stressors. If I have a dog who is in a higher state of arousal due to frustration, I'm putting management around those stressors. If I have a dog who is hyper-aroused, I'm looking at which situations are increasing that arousal, and I'm putting management around that. So an example of this might be noticing that there is high arousal related to sights and sounds outside of the house. So I might use window film and a loud fan or brown noise to block that stimuli. Or maybe I notice that my dog really struggles on walks due to frustration or anxiety, and that might mean bringing along some high-value treats to help them engage in activities along that walk that will help them calm down. And it may mean taking a break from walks entirely, depending on what the dog needs. It might mean looking at activities that I'm engaged in that increase arousal, like fetch or tug or playing with a flirt pole, and saying, my dog struggles to come back down from high arousal, so even when it's through something positive like a game, that is just increasing their stress hormones and making them less able to cope with other stressors. So I'm going to turn those games into an on-off switch game. So our management, and you can see how this also bleeds over into enrichment and ensuring that the dog's enrichment needs are met. And so that covers everything from vet care and medical needs to hygiene, which includes like being able to be groomed without big stress, to sleep, diet, nutrition, independence, safety, security, social, physical, and mental needs. We want to look really holistically and ensure the dog's needs are being satiated and satiated appropriately. Sometimes high arousal is a big red flag for underlying pain or medical issues. Dogs will use excessive exercise to distract themselves from the pain and for some temporary pain relief. So we certainly, and also aggression. Anytime we're looking at aggression, there's often an underlying health concern as well. The most likely category of that underlying concern is orthopedic. Second most likely is GI issues. I would also throw my hat in for allergies. And so that is one of the first things we want to do that goes under our management and enrichment, is we want to be talking to a veterinarian. For a lot of my clients, because we have a chronically dysregulated nervous system, we may be looking at the assistance of behavior medication, either daily maintenance medications, event medications, or a combination of both. And after all of that, we get to the behavior therapy. Again, what we're working on specifically is going to depend on the case in front of us, but largely we're working on things like changing emotion, increasing agency, which is linked to increased resilience. We're increasing resilience to stress. We're increasing the ability to self-regulate. We're teaching flight skills. We're working through that enrichment chart and saying, where is the dog lacking in having these needs met? Needs for, can the dog be independent? Can they calm themselves? Do they feel secure? And it's important that we're addressing that holistically. So if my presenting concern is intra-household aggression, it's just as important that I am addressing stressors around being seen at the vet, or reacting to noises and sights outside, or reactivity on the walks, or separation anxiety, because all of those things are impacting the dog's overall well-being, their stress levels, their stress tolerance or dystolerance. And so we need to look holistically. I like to think of intra-household cases as sort of family therapy. Everyone needs to be going to individual therapy so that they can bring their best selves to the table. This is why working with a certified dog behavior consultant can be really helpful, because this is a really nuanced plan. It needs to be based in evidence. It needs to be holistic. It needs to be trauma informed. And unfortunately, there are a lot of folks out there trying to treat trauma or mental illness with suppression, punishment, and aversives. So I hope that's helpful. Let me know if you have more questions.